Go.
All right, ready, go. And action. I'll go right down the list. Okay, first one, common carotid. We're doing them on the left side here. Common carotid. Internal jugular. External jugular. Cephalic. Subclavian. The axillary, artery, and vein. Here's the axillary artery. That's the only one we can really see good on this one. Axillary artery. Aortic arch. Aortic arch. Thoracic aorta. You continue down all that descending aorta, then it turns into the abdominal aorta after it passes your diaphragm, passes through it or behind it. Your abdominal aorta. Pulmonary artery. You have this structure here. Pulmonary arteries, that's taking blood out to the lungs. Pulmonary vein, that's returning the blood from the lungs to our left atrium. That one, well, I kind of punctured that one. Don't tell those two. Inferior vena cava. See that right there. Inferior vena cava. Internal intercostals, or intercostal artery and vein. Sorry. In between the ribs. Gastric artery and vein. Gastric, think stomach. So here's our stomach. So I'll pin a vessel by the stomach, and I'll tell you either artery or vein. I'll have to give you some sort of information for that. Splenic, here's your spleen, coming off of that gastric, or coming off of the stomach, will be our splenic vessels. And with this one, I'll have to give some sort of description, artery or vein. All right, now down to the mesentery. You have the mesenteric. What I'll do, where I'll label it right through here. So you get down to the small intestine, you have this nice looking fan pattern here with these vessels. I'll just label it there. Really more accurate would be down. Oh, this is a nice pig. More accurate would be right there. But I told previous people I just label it up there. Even though that's something different. Now go to the kidney. We have renal. So kidney will be renal. This one you can see the vein, which will be blue, and the artery is going to be red. That's a nice, couple nice vessels. Iliac. You go down here to the abdominal aorta, the inferior portion of it. It's going to start branching. This first one we're going to use as our iliac. Artery, vein. This one you can see the artery. It's coming off of that aorta. The vein is behind that. It doesn't have any blue in it, so it didn't get the latex. Now you continue down iliac. Iliac will eventually lead to that femoral. So femoral I'll pin way down here. And then there's your femoral vein. That's kind of deflated. And umbilical artery. We'll label that right here. Follow that aorta coming down to your umbilical artery. Yeah. And that's it for the vessels. Cardiac structures. back up to the heart. You have the sac, pericardial sac. We'll put that back on there. Oh, it's all wrinkly. Spun around. Pericardial sac. There's your sac. I'll take that off of there. Now we have your right atrium, left atrium. Those are the flappy dog ear looking things. Left ventricle, right ventricle. Ductus arteriosus, that's one of the bypasses that I forgot to tell you guys about. That's going to connect your pulmonary artery to your aorta. So it's going to bypass the lungs. I'll hook in there and see if I grab something. That's going to be a little shunt. Let me stick my big fat head in there for a second. Hi guys, it's me. There, right there, it's over the probe, tip of the probe. I could just be making that up, but you'll never know. But it is connecting that to that. Pulmonary structures, we have our trachea. You feel the cartilaginous rings going down that. Thyroid cartilage, it's a big shield anterior, thyroid cartilage. Then we're going to go to the lungs. Lungs are right here. Lungs. Ooh, wait. Lungs. And then the diaphragm, also known as diaphragm. This is your diaphragm. You can see it's still attached here. So your diaphragm, there's that separation between your thoracic and abdominal cavity, that diaphragm. You can see more of it there. And that is it. And cut.